My name is Michael Silverman. I'm a cardiologist with Cardiovascular Specialists of Central Maryland. I've been in practice since 1994. There are many risk factors that have been found to be associated with heart disease. Diabetes is very high on that list. People who smoke should certainly be concerned. People with hypertension, people with high cholesterol need to be worried. Certainly folks who are sedentary and who are overweight also need to be quite concerned. There's even evidence that people who have sleep apnea can be at risk for heart disease. Family history is another risk factor for heart disease. If you have a male in your family who had heart disease at an age younger than 45, or a woman in your family who had heart disease younger than 55, then that increases your risk. So people often confuse that. They think that if grandma had a heart attack at the age 80, they're at risk for it. That's really not the case. It's really only the case when it's a young family member that's had the heart disease that puts your risk at an increased level. The most important symptom that we see with a heart attack is that of chest pain. The classic description is that of chest pressure, chest tightness, or chest squeezing. Some people describe it as a brick or an elephant standing on their chest. Not everybody is classic and out of the textbook. Some people have radiation of those symptoms to their neck, to their jaw, to their shoulder, to either arm. Some people have those symptoms along with shortness of breath, nausea, and sweats. Some people have no chest discomfort at all and just have shortness of breath. Women don't present in the typical manner. Sometimes they'll have shortness of breath. Sometimes they'll just have fatigue or exercise intolerance. First and foremost is find the nearest telephone and call 911. The second thing to do is to find 4 baby aspirin and chew them and get them down as quickly as possible. If you don't have baby aspirin at home, certainly you can chew 1 adult aspirin as well as another alternative, and then just wait for fire rescue to get there. High blood pressure is a risk factor for heart disease, and if you don't control your blood pressure, you're at risk for a variety of things. Those things include heart attacks, strokes, blindness, kidney failure. So it really is important that you know what your blood pressure is. If you do have high blood pressure, I suggest that you go to the local pharmacy and get yourself a blood pressure monitor so you can check it periodically. I often find as a physician the results that I get from home are more valuable than the results in the office. It's your natural environment, it's where you live, and it's just more meaningful than a quick blood pressure under the bright white lights in a doctor's office where you might be a little bit anxious and it might be a little bit falsely elevated. One of the problems with the American diet today is that sodium is hidden in all of our processed foods. I highly suggest that when you go to the grocery store or wherever you go shopping that you read the labels and read the sodium content and really know that you should not be eating more than 2 to 3 grams of sodium in your diet per day. High sodium diets can lead to hypertension, can make your hypertension more difficult to control. If you have a condition called congestive heart failure, it can also make management of that condition more challenging as well. Diabetes is one of the more worrisome cardiac risk factors. In fact, when somebody has diabetes, I equate that with a coronary artery disease equivalent. What does that mean? That means that I assume that you have coronary artery disease until proven otherwise. Your risk for stroke is also significantly increased. I think it's very important that all patients know certain numbers about their health. Certainly they should know their blood pressure. They should keep records of their blood pressures. A lot of my patients keep them on Excel spreadsheets. That's important to know to bring them in when you see your doctor. It's important to keep flow sheets of your lipids, not only the total cholesterol, but the breakdown numbers as well, the LDL, the HDL, and the triglycerides. Certainly to know your sugar as well. Another long-term measure of diabetes and glucose control is something called the hemoglobin A1C, and somebody should know those numbers as well. One of the other important things to consider is including exercise in your daily routine. The American Heart Association now recommends that you do an hour of aerobic exercise 5 days per week. Most patients of mine are not very happy about that when I hear that, but when I work with them, there's often a way that they can come close to that. Certainly there's 2 weekend days, and even if they get a half an hour in on 3 or 4 weekdays, that's certainly of significant value. And by aerobic exercise, walking, swimming, biking, running, it really doesn't matter what you do, you just have to do something.